You are listening to I Am Refocused Radio with your host, Shamaya Reed. This show is designed to inspire you to live your purpose and regain your focus. And now, here's your host, Shamaya Reed.
Hey, welcome to I Am Refocused Radio. We are here once again, and today we're going to be talking about an awesome topic. We're going to talk about a new book, Chronic, the Hidden Cause of the Autoimmune Epidemic and How to Get Healthy Again. And we have the true honor talking to Dr. Stephen Phillips and also DANA PARISH. Good morning, you guys. How you doing?
Good morning. Thank you. We're good.
Good morning. Great to talk to you.
So starting with you, Dr. Phillips, tell us a little bit some of the takeaways of this book and how the readers can learn to better their lives, especially coming back from health.
Yeah, so the underlying premise of the book is that there's so much medical evidence that chronic infections underlying cause this very broad range of chronic illnesses, and things like fibromyalgia, multiple sclerosis, rheumatoid arthritis. Your listeners may not know that the data is so strong in medicine, but it's not really trickled down to the public because right now doctors are very much incentivized to prescribe expensive medicines to suppress the immune system and just keep people on medicines that dole out little bits of health, and it doesn't really cure them. I mean, before we wrote this book, I'd come down with a very bad case of a chronic illness, and it was diagnosed as rheumatoid arthritis and the type of arthritis of my spine. And I was completely disabled, and I had 24-hour home care, didn't walk for 2 years. And, the only thing that doctors offered me were immune suppressants. And now I'm fully well and back in practice since 2013. And we wrote this book to provide hope for folks with chronic illness, to say, look, there are about 10 different infections that could be contributing to this. And what your doctor doesn't tell you, we will.
And Ms. Dana, I'm going to bring you in also. You had experience going through an improper diagnosis. Tell us a little bit about that, what your experience.
Sure. Yeah. So in 2014, in the summer, I left my home in New York City, went to a wedding in New Jersey, and came back extremely ill from a tick bite that transmitted Lyme disease to me and another infection. I was at the prime of my life and career, and all of a sudden I was having like severe body pain, anxiety, depression, a tremor. I couldn't feel my foot or my hands. It was absolutely horrifically terrifying. And I went to 12 top New York City doctors. I did get the initial diagnosis, and I was given 3 weeks of an antibiotic, but it wasn't enough. And it was very obvious that my symptoms just continued, and they got much, much worse. I went to 12 top New York City doctors, and nobody could agree with me that my symptoms were caused by this infection or these infections spread by the tick, and nobody would treat me, even infectious disease doctors. So I went into heart failure by December, so like about 5 months after my bite. And at that time, somebody thankfully sent me to Dr. Phillips, and he recognized that all my symptoms were my obvious case of Lyme, what they were, and he treated me. I was out of heart failure in a couple of months, and all my symptoms resolved within the year. And, I can't believe how many people I know now who have never gotten to a Dr. Phillips, who have never gotten to the bottom of it and just been gaslighted by the medical community, telling them it's all in their head. And, I knew it wasn't, regardless of what I was told, but it was really hard to keep going when you're that sick.
And back to you, Dr. Phillips. In the book, we hear about the term long COVID, and there's science, like you both have stated, that backs up some of the root causes of finding diagnosis. Can you touch on that with the audience and how important it is for the patient and the physician to find root cause of the actual problems?
Finding root cause is the critical kind of holy grail in chronic illness determination. So I find that long COVID is grouped into a few different categories. You have some patients who were very sick at the beginning, and they have persistent, like not enough oxygen getting into their lungs when they exercise after COVID, and they slowly get better after like 3 to 4 months. And in those cases, there's a lot of damage to the vessels supplying the lungs, and they're slowly healing over time. Then you have these other patients that get long COVID that maybe had minimally symptomatic or even, not at all dangerous cases of COVID, nothing with lung damage at the beginning. They have this asymptomatic period for a month or two, and then everything starts going out of control and going haywire. Those patients, you can't make the case that, they're recovering slowly from chronic damage. So which is it? Do they have the virus that causes COVID still in their body doing damage? Or did the whole immune system shakeup that occurred at the time of COVID, did that set the stage for reactivation of other infections? And what people don't realize is that many times there are other asymptomatic infections that we just carry. People live with things like Lyme and other infections in their body, like here in the Northeast where we're located. 10% of people who are healthy test positive for Lyme. What if those people get a bad case of COVID and their immune system gets shaken up, or if they get a bad flu? And I have seen patients way before COVID was ever a thing that they would come in not with a history of bug bite, but a history of a bad case of influenza or a bad case of mono or dengue fever or whatever, some bad virus, and then they're chronically ill after that. And we search for underlying infections that reactivated, and we treat them and they get better. So, I don't think it's a coincidence that the symptoms of long COVID overlap with the symptoms of chronic Lyme, something like 90-something%. And like everyone's noticed it. It's kind of uncanny. So we think that could play a role in some of these cases.
Once again, it's a true honor talking to you both, Dr. Stephen Phillips and also DANA PARISH. You can read this book if you listen to this on Focus Radio. The book is Chronic, The Hidden Cause of the Autoimmune Epidemic and How to Get Healthy. Again, very educational book, very enlightening. I want to say thank you to you both for taking time, your busy schedule, talking to us today.
Thank you so much.
Our pleasure. Thank you.
I Am Refocus Radio is brought to you by Foo 4 Star and Holy Crab. Foo 4 Star is a family-owned Asian restaurant in San Antonio, Texas. We have been a local favorite for Asian cuisine for over 10 years. With nothing but full smiles and fast service, you'll be leaving satisfied. Come on in for some authentic Vietnamese food. Holy Crab is one-of-a-kind Cajun Creole-style seafood restaurant located in Universal City, Texas. We offer traditional seafood items as well as chicken and steak. We also offer seafood boils. Come give us a try. You won't be disappointed. You can find these two eateries in Universal City, Texas at 2921 Pat Booker Road.